So welcome everyone. This is the Aurora Health Alliance Social Determinants of Health Interest Group meeting. My name is Tessa Carlson and I am one of the co-chairs for this group along with Julia. Our first presentation, I'm excited to introduce, well, you just met her, but Gabriela Jacobo, my colleague, is going to tell you about Alba Cooperative. So Gabriela, take it away.
Thank you. I am so glad that I was invited to talk about El Alba Cooperative. Some of you are familiar already with El Alba, but if not, I am more than glad to share a little bit about it. So I bet you, Tessa has already shared. Tessa and I used to be with the Community Campus Partnership. A lot of you are familiar with the initiative of the University of Colorado. And this closed in May of 2019. But while we started community engagement with the anchor mission with the University of Colorado at the Anschutz Medical Campus, we conducted several connection campaigns. The connection campaigns were a way of meeting on a one-to-one with residents in North Aurora specifically. Out of those connection campaigns with the Community Campus Partnership came the Resident Leadership Council. Out of the Resident Leadership Council came several connection campaigns and this is not the PowerPoint that I wanted to share with you, but wanted to show you our Resident Leadership Council and how out of the Resident Leadership Council came a third connection campaign meeting with community members through a series of community network breakfasts and dinners that CCP used to conduct in the community. Some of you might have attended those breakfasts or dinners. We brought institutions or community organizations and residents together through a meal, either breakfast or dinner. And we would, out of those, I started in 2017 a connection campaign with entrepreneurs, residents that were developing or had already their small business and were working in North Aurora, but didn't have the resources or had a series of barriers to continue to develop or move their business forward. Out of that connection campaign came a series of trainings and workshops for small business, and we would conduct those in their language. Most of those small business owners were Spanish speakers, and we started working with the Center for Community Wealth Building to set up a series of workshops to provide either support on accounting or marketing and other resources. It just landed of a series of connections where we ended up working also with Mikasa Resource Center and continued to provide resources to our small business owners that we started a relationship. Out of those workshops started a conversation with the food services small business owners. And we ended up, through the guidance of Center for Community Wealth, ended up having a conversation of the creation of a cooperative as a business for all the small business owners that were specifically centered in the food services area. And creating a cooperative has been a long journey. But we ended up with El Alba Cooperative, which is a catering and / food services cooperative with membership of small businesses, not by individuals, but by small business. So we continue to promote of the development of small business or supporting our small business in Aurora, specifically guiding them through a path of training and an educational pipeline now supported by City of Aurora Small Business Development Center, and of course, now transitioning from Community Campus Partnership with the Office of Diversity, Equity, Inclusion, and Community Engagement. I am going to share with you what I have from El Alba Cooperative, so you get to get a little bit more familiar with El Alba. So El Alba Cooperative, as mentioned, is a cooperative, a full profit business with members of small business in Aurora. Now that we are with the Office of Diversity, Equity, Inclusion, and Community Engagement, we are opening this to a broader area, but at this moment, all of them are in Aurora. A thriving cooperative business owned, operated by benefiting community members in North Aurora. And as I just said, we're expanding collaboration between interrelated businesses and nonprofit entities with a shared mission of economic, social, and cultural empowerment for immigrant, refugee, food service business owners. And we, of course, I don't know if some of you have heard, but right now, not right now, right after COVID, it has been a more challenge, but even before COVID, one of the challenges for our small business and food services is the rent of commissary kitchens. These are high priced, and now with COVID, they are in high demand. And a lot of our food services small business have to drive long distance for cheaper and economic commissary kitchens. And of course, the majority have to have a membership so that they continue to have their license and their business running. So that El Alba Cooperative's main mission, besides the educational pipeline, which is the nonprofit part of El Alba Cooperative, is to build a commissary kitchen, have a commercial kitchen owned by El Alba Cooperative. That means by small business members of the cooperative. Our collaborators in this journey have been out of the connection campaigns, our Resident Leadership Council, which we continue to work directly with residents, Aurora residents. Of course, the Office of Community Engagement of the Office of Diversity, Equity, Inclusion, and Community Engagement of the university, the Aurora Economic Opportunity Coalition, Mosaic Unlimited, City of Aurora, and our champion council member from Ward 1, Cristal Murillo, the Denver Foundation, and one of our amazing champions also, our cooperative specialist attorney, Linda Phillips. And like I mentioned, the cooperative is a full profit business owned by our residents, small business in Aurora, but it has a component of incubator. We want to continue to provide resources, and if it's in any kind of way, in the language of our small business owner. And we are working with this through the City of Aurora Small Business Development Center, who have been very supportive and have been able to partner up with a series of trainings. And out of those are individual business plan curriculum, the customized learning path of one-to-one guidance, so unlimited one-to-one consultations with the SBDC. We created a cooperative training manual in English and Spanish at the moment, and working with SBDC to put this and promote this throughout Aurora, and leadership and teamwork coaching as well. Our steering committee at the moment is out of two of our members, Lourdes Lozano, representing Lozano's Food LLC, and Josephat from Musasi Kenyan Cuisine. And hoping to transition into a full co-op membership board. I bet all of you are familiar with North Aurora, and if you can see in this map, this is an old map that City of Aurora SBDC, well, actually not the SBDC, just City of Aurora developed to identify the business area. And right here in purple, right in the corner of Dayton and Colfax, that's where we have identified a building for El Alba Cooperative to start construction for a commercial kitchen. Throughout late 2018 and all 2019, when things were really normal and we did not have this crisis, we were promoting El Alba Cooperative members with their catering services, with many departments at the Anschutz Medical Campus, but then started to promote this, and our list of clients started to grow. And here you have a list of organizations and groups and institutions that loved our caterers' food and service and would nonstop request service from El Alba Catering Service. Unfortunately, with COVID, things are different, and we got shut down on campus, and a lot of organization companies, you already know, are working from home. So we are not able to do catering, but are starting to promote this back again while things get back to normal, with the support of various vaccine clinics and people getting a little bit more confident while returning to their working space. This is the building. I bet a lot of you have drove by. This is actually modified by the architect working with El Alba, where we would modify the different areas of it's kind of like a long stretch building, 2,200 square feet. And hoping, we know that it's not going to be a big commercial kitchen, but small is beautiful. And for our startup of El Alba Cooperative, I think that we have identified a great space. This is how it looks actually right now. And it's right next to the Dayton Labor Center. Rich, you are more than familiar with that area. And we are hoping that this would be the home to El Alba Cooperative. What we're doing is working with City of Aurora and the landlords for this building. We are in agreement to divide 1/3 of the cost of the renovation and construction for the commercial kitchen. That meaning that the landlords for this building would be responsible for 1/3. City of Aurora SBDC would be responsible for 1/3, and El Alba Cooperative is responsible for 1/3 of the cost, and besides equipment for commercial kitchen. Like I mentioned, 2,200 square feet for this space, not big enough, but the other awesome part is that El Alba continues to build collaboration. We have received tremendous support from Tri-County Health Department, working really close with Caitlin and Sheila. They're amazing champions to El Alba Cooperative. And working with the Aurora Economic Opportunity Coalition, we have built little by little other candidate collaborators to hopefully expand more commissary kitchen space that we have identified with other projects popping up in North Aurora. But at least for El Alba Cooperative, like I mentioned, starting at Dayton and Colfax. And we do have an agreement of rent, a very accessible price of rent with the landlords, and what better than them committing also for the renovation and construction. This would be the layout for our commissary kitchen. It's a lot of equipment. I don't think I have to go through it, but you get the point of commissary kitchens. This design is to review once we start planning, once we start the renovation and construction of that commissary kitchen, which we're hoping that it would be by the end of this year. We were hoping that this construction was going to start in this summer, between the winter of last year and this summer, but COVID, as it has happened for El Alba and for all of you, changed completely and drastically our plans. We are calculating with City of Aurora that this is going to be around over $700,000 of a project, and like I mentioned, being 1/3 of responsibility through the landlords, City of Aurora, and El Alba Cooperative. We have done fundraising through the catering service throughout 2019, but that stopped, and we started to do planning and started to get with the support of our Office of Diversity, Equity, Inclusion, got referred to some foundation for some capital funding, and Gates Family Foundation has supported El Alba. The University of Colorado, through our Office of Diversity, Equity, Inclusion, is supporting El Alba. And we have right now conversations for a loan with with Gary Community Investments. We are thinking that El Alba will be ready with 1/3 by the end of this summer, and hoping to present to City of Aurora as we did back in 2018 to move this project forward. Hopefully as well we're turning in a report this week, and we're hoping to get an opportunity in the coming months, in the next couple of months, to do that as well. I'm not going to overwhelm you with the cost, but a lot of you are familiar with the process of fundraising. And we've done a lot of that due to COVID and changing plans of our caterers not being able to do catering services. And one of those, for one of those modifications, El Alba purchased a food trailer. And we are right now, with the support of 2 of our cooks, co-op members, we are working the food trailer to continue to do fundraising. But as I mentioned, also applying for capital funding with a few foundations. Of course, we had to turn in a good business plan to our Small Business Development Center. It's a very complex plan for El Alba Cooperative. City of Aurora has been very attracted to our business plan and the model of El Alba doing this work from the down up. That means starting with our community members, and not to take any value and saying from the down up, but that's a lot of the times the way that we are used to thinking, that our community is all the way to the bottom, but El Alba showing that our community can be all the way to the top. And it has been a grassroots work, and all the efforts gone to our co-op members, those that started it and have not been able to stay with El Alba due to COVID and had to go into other jobs, but hoping to get them back. And a few candidates that we have now coming up, and those that have stayed and continue to work hard with us. Again, a few numbers that you don't need to know, but I had this presentation for one of our foundations and thought that I would share it with you so that you can see a lot of the efforts and a lot of the work that we put through El Alba. We're talking about us presenting to City of Aurora back in August of 2018, and developing El Alba Cooperative as a full running business with an incubator educational pipeline has taken us a lot because we didn't have the financial infrastructure to do so. It's all based on our co-op members' effort. And that means a lot of their money coming out of their pockets for their own investment in their own business that has been through a lot of trouble through this COVID pandemic. This is a brief sharing that I wanted to present to you so that you're aware that our community members in Aurora do not give up even in the most harsh circumstances. And this is a summary of our efforts put together for building El Alba Cooperative, continue to do the economic development through our work with the Office of Diversity, Equity, and Inclusion, and knowing that we will continue to support residents in North Aurora through our work. And like I wanted to end up with this because it looks very simple. Our El Alba Co-op food trailer, it is located on 1521. It's the parking lot of the Dayton Labor Center, right now fully running from 8 a.m. to 12 p.m. with a Latino menu. And we are supporting also food trailers and food trucks. And El Alba has right now 2 food truck members, one with a Latino menu and the other one with a Kenyan cuisine. And we have one more candidate with Texas barbecue, which we are in conversations with. And we are hoping that we will be able to promote our food trailers as well in North Aurora. Any questions or comments?
Thank you, Gabriela, for this wonderful presentation. It's clearly been a lot of work getting to this point, and I love all the strategy behind all the planning that you've gone through. I'm wondering, in future states moving forward, if you all, if you believe that the income that you'll make through the kitchen and the catering will be sufficient to cover the costs, or if you you feel that you'll need to continue to do fundraising to cover El Alba's cost moving forward.
Yeah, believe me, this is one of the parts from between 2018 and 2019 was building our business plan. And it's so complex because we had to show sustainability for El Alba as a profit business, as a full profit business. So we not only know that it would sustain itself, the structure of a cooperative is that once established and promoted, as we were doing in 2018 and 2019, where the demand was high for our co-op members, is that it will give enough profit even to give to have end of the year a good earnings, where we are already in conversations with some of our co-op members to structure the co-op to hopefully reinvest those earnings, end of the year earnings, so that we can talk about either a second El Alba co-op or other type of project that would continue to support our community members.
I have a question, Gabriela. You mentioned expanding. So does that mean you're looking at going into like Denver, or are you looking for ways to include new co-op members, and how would someone join the co-op?
So right at the beginning, because we were so limited, we were only thinking of the educational pipeline. We were saying we will support, because our connection campaign happened in North Aurora. We were thinking we will support only North Aurora entrepreneurs, and that was with Community Campus Partnership. But now we have unconditional support from our chancellor, and we have proven that our hardworking co-op members are more than ready to make their business successful, that more people are becoming collaborators for El Alba, and there has been good support. Like I said, we have presented our business plan and our project to foundations, not only the City of Aurora supporting us 100%, but to foundations, and knowing that now we not only can stay in North Aurora and put conditions for our entrepreneurs to be from North Aurora. Now, if there's any food services business owner that has their license for Denver, for Aurora, El Alba is more than ready to support them on not only the resources, but promoting them as they become members.
Thank you.
I'm hoping that pretty soon you will be hearing from us, at least sending or sharing, coming to visit to send you some groundbreaking pictures of hopefully renovating and starting that commercial kitchen to support our food services and business owners, and that you will be more than willing to support our food services, our co-op members, either by stopping by at 1521 at the parking lot for the El Alba Latino menu, or hopefully pretty soon coming with the Kenyan cuisine and the Latino menu to the Anschutz Medical Campus on their Wednesdays food trucks. Again, right now, due to COVID, we are promoting and accepting membership for food trucks, but once that commissary kitchen is renovated, we're hoping to start promoting back again our catering services. So thank you so much for just giving us this space to talk about our hardworking entrepreneurs in Aurora. And yeah, I'll update you. Thank you, Tessa, for the opportunity.
Thank you, Gabriela. Okay, well, now let's turn it over to Rene Gonzalez, and you'll give us an update about the Health Equity Task Force at Colorado Access.
Thank you, Tesla. And Gabriela, thank you for your presentation. I just want to make sure, for those who may not speak Spanish, what does El Alba stand for?
Thank you. I missed that. That is very important. So as our city is called, well, I'm not sure if some of you are in Denver, but for us being at Anschutz Medical Campus and for our Aurora residents, our city is Aurora. And even though Aurora is also a Spanish word, El Alba would be another word for Aurora. So the beautiful lights that either a beautiful morning with mist or just of nature will give you, that is El Alba. So picture El Alba, picture Aurora. That's how we picture ourselves. Thank you, Rene. Thank you.
Yeah, no, thank you. It's a great name. So I'm Rene Gonzalez. I work with Julia on the Community External Relations teams at Colorado Access, and we serve the state's Medicaid or Health First One Colorado members for the Denver metro area, Adams, Arapahoe, Denver, Douglas, and Elbert counties. And so I presented back in January, February about the Health Equity Task Force, and I actually listened to Rich. When he says something, we all kind of make sure we're listening, and he made a point that resonated with me back in February about, then what? We talk about the Health Equity Task Force, but is there any follow through? And so I purposely reached out to Julia and said, let me provide an update on this work, because I don't want Rich to get mad at me and I just say something and I leave, and nobody wants to get on Rich's bad stuff. And so I'm just trying to work that piece out with Rich. And with that being said, I have a few slides on, I'll level set for those folks who haven't been part of the group back in February, and go into some of the slides from there. Let me just share my screen here. Okay. Is this in presentation mode or, okay, let me see. How about now? Okay, thank you. Okay, so I'll just shift slides here. As I mentioned before, I'm just going to refresh folks about what we talked about in October to December of 2020. This is where I convened a group of external stakeholder members, really to focus on a task force responsibilities, which is a finite group of folks to help us inform our work in the health equity space for Colorado Access and for the communities we serve. And so, we're trying to develop this multi-year health equity initiative, and it's with these external engagement partners that we need at the table to voice their concerns or strategies or what's going on in their communities. And so we met 5 times in about 2.5 months with this task force, and these are the things that we came up with, that we validated, that we heard them tell us. And so I'll talk a little bit more about the themes in detail, but I wanted to share these things for you. We talked about community and health literacy, equitable and inclusive clinical and health interventions. So whenever Colorado Access tries to promote some kind of health intervention, that we have a equitable lens in any type of intervention work that we're going to do. Access to care, crisis planning and response, obviously because of COVID, but we also don't want to narrow ourselves. There's for our communities of color, there's always some type of potential crisis or current crisis that's either COVID related or non-COVID related, but it's a crisis moving forward. We also wanted to emphasize a diverse and inclusive clinical and workforce and culture. So what does that pipeline look like moving forward for people of color wanting to get into the healthcare field? We also identified some cross-cutting themes that went over through the entire area around social determinants of health, member and community engagement, and then data equity. Just sharing what's the story around data and how can it inform our work. So what we did is, in between these meetings, we really unpacked the meeting notes, and I want to thank Joe for creating those meeting notes, because we weren't going to be able to unpack these on ourselves. So we really, first of all, as a group, as an internal group, we try to set a vision with these themes, and then we presented the visions to our health equity task force validation, and then we started to unpack these comments within each theme. And so, we talked about, and so when you look at the sub themes here, these are word for word verbatim thoughts from our task force. And so we wanted to make sure that we were capturing that, and we were going to help, it was going to help us inform this work. And so I don't want to go through each of these sub themes, but I'll be happy to share my slides later. But you can see that within each theme, there's these sub themes, right, that we're creating. I was just wanting to make sure I was looking at the notes to make sure that I wasn't missing anything as I go through my presentation. So I hope you talked through, or you looked at some of the comments that were mentioned before, or as I presented this slide. So we have, we created these visions for our clinical and health interventions moving forward, and what we need to be paying attention to based on these sub-themes and comments from our task force, including families and caregivers in the interventions. Interventions don't always have to be clinical, meeting patients where they are, interpretation and translation services. If we are doing some kind of intervention work, what are the racial and health inequities when we do these particular interventions as well? So, and there's also a lack of evidence about doing clinical intervention work, because historically it was based on Anglo-Saxon population groups and not Black, Indigenous, people of color, BIPOC communities. Access to care has always been a continuing barrier for our communities of color, and so we wanted to make sure that we are providing equitable access and care at the right time and at the right place. Network adequacy has always been a challenge for Colorado Access and for the larger community. We want to make sure that the payment structures and reimbursement rates are equitable for what we're trying to provide our providers who are reaching out to our communities of color, and then general barriers of access for our communities of color. So there's a lot of great insight that we received for our task force. Crisis planning and response is an urgent need, and we wanted to make sure we captured that. And as I was thinking through this before I had to present, maybe Julia, we can invite Cassidy and Anna to talk about our COVID intervention work that we're trying to address for our communities of color and for those communities that are homebound. So those members on Medicaid that can't leave their home. And so we're trying to figure out a way to get them the COVID vaccine as well. So that can be a really cool next topic meeting, is inviting Cassidy now to talk about the specific areas. Let me just check the notes really quick if there's anything in the chat, if there's any questions. Okay. Yes, I will share the slide deck. Okay, perfect. Thank you, Tessa. All right. Let me move on to the next slide. Okay. Wow, diverse and inclusive clinical workforce and culture. This received a lot of energy, and it's interesting because as Colorado Access, we don't do this type of work, but we do want to recognize that it's important, kind of an upstream approach to how we help support our communities of color. And it received so much energy that we actually captured it for our next phase, which I think Rich is probably really interested in learning more about. I just attended another large group, which Joe was a part of, and this workforce pipeline idea just came out organically with some of our system partners, and we had to capture it. So we wanted to make sure that this is part of our work moving forward. These are just additional comments that were made that we're capturing through the notes. We're still going to unpack these a little further and figure out where they land, but we wanted to make sure that we are not losing what people are saying to us. So what are we doing with our health equity task force? How can we leverage their insight, the comments that we received, and kind of filter that energy through the what we call the Colorado Access Community Innovation Pool. And what this particular pool does is, historically, every physical and behavioral health incentive that we receive, we actually get paid out by healthcare policy and financing. And so with the monies that we get paid out, so for every dollar that we get paid from HICPUF, about 60 to 70 cents on the dollar goes to our providers. And then we get about 20 cents for actually managing the whole process. And in the past year and a half, we created a community innovation pool, and we said every 10 to 20 cents of dollars that we earned goes to this community innovation pool. And so this is the year 2 of these dollars in this community innovation pool space. So we wanted to do some innovative work. And we learned a lot from the first year, how we can improve the process. And so what we wanted to do for 2021 with this community innovation pool is, one, take as many themes as we could from our health equity task force and align them where we want to focus our community innovation pool dollars. So on the bottom kind of right-hand side, you have these, it's green, 2 red, and a purple areas of focus. So we said we want to use these community innovation pool dollars to focus on trusted community partners, high-risk maternity, substance use disorder, and workforce pipeline. And so this is where we start, as Rich said, what are we going to do with this health equity task force? Now we move forward. So we are literally putting our, what's the saying? money where our mouth is. And so we are putting monies towards these specific areas that also overlap with our specific themes with the Colorado External Health Equity Task Force. So you can see the alignment in these areas. Now, there's other space, as I mentioned before, crisis plan and response. Colorado Access is actually doing things without the community innovation pool area. So that's important to really emphasize as well. Let's see here. So this community innovation pool is really interesting. We have 2 tracks. So the first track is very traditional, but we made a few tweaks based on some lessons learned from the first year. One is we are doing a letter of intent. So instead of getting folks to apply through this very long, lengthy application process and having it turn into us with the, I guess, the uncertainty of actually getting funded, we actually want to prevent that piece from applicants, so they won't have to take too much time and just provide a letter of intent in the pre-screening phase. The other piece is we also want to make sure that we provide application assistance for those agencies that don't have these large systems that have a grant writer specific or grant writing departments. So we want to provide support in that area as well. So this first structure is going to be very traditional in the sense of kind of requesting for funds in this area. And I will say the overall emphasis for this community innovation pool is going to be strictly on health equity. In the previous year, we talked about health equity and telehealth services, but now we're just focusing on health equity specifically, so making that emphasis. Track 2 is a very innovative approach. It's going to be called the Health Equity Design Challenge, and we're really going to convene community and provider stakeholders to actually target one of those areas that we identified here. So we're going to split out one of the, whether it be high-risk maternity, substance use disorder, workforce pipeline, or trusted community partners. We're actually going to take one of those and put them into the Health Equity Design Challenge. So we haven't decided specifically exactly which one of those are going to go into this pilot project. But it's a really great opportunity to take an innovative approach to invite community to help us target one of those aforementioned areas and have a collaborative discussion and funding discussion around one of those specific areas. But we do want to make sure that that this collective impact model is part of this piece, and that we want to recruit individuals from the community. So we are going to provide a stipend. So this track, this health equity design track, is really going to be it's going to be a 4-series or 4-session long opportunity to focus on a challenging problem. And so I want to make sure that folks were aware of that piece. And I want to make sure just to figure, I know I'm close on time. So I don't know, I can go into, let's just stop there because I know there's like 3 minutes. Perhaps folks would have some questions about this piece. But more importantly, I want to make sure that I address Rich's concerns to make sure that we are really taking the information that we receive from our Health Equity Task Force and we're putting it into some viable next steps for our community through the Community Innovation Pool program and through opportunities for funding. So I'll stop there, and I'm sure there's a few questions, and I don't mind staying over.
Thanks, Renee. I don't have a question, but just a comment. Some of the work that I do is career exploration activities in the health sciences for Aurora Public Schools students or other, institutions that serve a similar population. So I just wanted to offer, happy to support if in that workforce development area. I know that there are other ways that our office is looking on changing hiring practices and things like that on the campus, but just wanted to offer my support for that piece if it is helpful.
Yeah, thank you, Tessa. We haven't unpacked or baked out a full strategy on workforce pipeline because it's really not part of the work that we do, but we are looking to partner with agencies that do this type of work and be thought partners in this space. So thank you for that.
Really a comprehensive plan, Renee. I know it's taken a lot of work to get here, and it's great to see that there's now direction. You have to have structure to it. You have to have a plan, and that plan looks like it's something that truly our community needs. And I'm glad, like Tessa's organization would be part of it, and others would come part of it too, because it's our community in Aurora tends to be, over the years, just segmented and on the true issues of health, and we've neglected them because everyone's doing their own thing and we're not working together. So it's good to see that now we have a plan that could bring us together. So we'll be talking more on that with Julia and Renee.
Thanks, Rich. And I hope we have you as part of the Health Equity Design Series Challenge. And we would welcome your presence and your expertise. So I will say that we are in the next few weeks, we'll send out a promotional piece to have folks register. We're cleaning that part up and making sure that we get all the information. So thank you.
Any other questions or comments? Okay, well, thank you so much, Renee. I think Gabriela hopped off, but thanks to her too, and everyone for joining us. These presentations were great today.